Hello and thanks for watching Chunk and Check. We're going to carry on our PEDS series with a video on fever and its causes.
That's right. A lot of kids present quite non-specifically, and fever seems to feature 9 times out of 10.
Is it me or is it really hot in here?
You need to chill out.
Before we go any further, let's remember our limits. As a general rule, to make sure you don't miss anything nasty, in a baby less than 3 months, a temperature over 38, admit. Age 3 to 6 months, over 39, admit. No messing about. Things can get nasty quite quickly. You've got a bit more flexibility in older children though, as they can regulate their body temperature a little bit better.
Red flags for fever include a non-blanching rash, headache or photophobia, persistent temperature despite paracetamol, not eating and drinking, and as always, parental concern, because mums know best.
Hi Mum.
If the parents have measured the temperature, find out what it was or get a rough idea if they can't remember.
Ask if they've done anything about it yet. Calpol is the old favourite, they've probably had a few spoonsful of that.
Other brands are available.
Babies pick up loads of infections and Calpol usually sorts out the fever, but if not, you need to think a little bit harder.
When a child presents with fever, the goal is to find the source. Pretty much anything can cause a fever in kids. Headache, earache, tummy ache, sore throat, UTI.
We'll just focus on the 5 most common causes in no particular order.
First up, UTI. You should know these inside out as a medical student. They're easy to rule in or out with a urine dipstick, which is positive for nitrites and leukocytes.
The obvious signs and symptoms are painful urination, frequency and hematuria. The trouble is, if the child is too young to speak, they can't tell you what's wrong. So presentation is more general, often with vomiting and reduced oral intake.
In fact, vomiting is true for all conditions we're talking about here in the under 12 monthers, so it really doesn't help you differentiate.
True, I guess, but this next one's a biggie, and vomiting can occur in all ages here. Meningitis, it's got the potential to be fatal and leave with some serious deficit. Bacterial is more serious than viral, but they all present in the same way. The lumbar puncture is used to differentiate between types and to target treatment.
Classic symptoms include headache, neck stiffness, photophobia and a non-blanching rash and sepsis. In the younger ones, you might find a bulging fontanelle and a reduced oral intake.
Pause the video now to read what we've got for you about the management of meningitis. So, tummy ache next.
Just because we're talking about kids doesn't mean you have to talk like one.
Sorry, gastroenteritis, another cause of fever. The big giveaways here are the classic D and V.
There might be some blood in the stool too, as babies' bowels are more sensitive to irritation. You'll also get a generally miserable baby with abdominal pain.
Again, you've got to watch out for dehydration. Next up is the ERT.
So many abbreviations, I bet.
We'll put otitis media in this group too. There's so many ear infections in kids. Probably
the only condition you can work out from your baby. Pulling at the ears is the telltale sign. If you manage to get a look in the ears, you might see some discharge or a bulging tympanic membrane.
I don't think we need to waste time telling you the symptoms of a cold, so we'll move on to the lurties. I don't know if that's how you say it.
I'll just go with it. Only way you can work this one out is by having a good old listen. There'll be a cough, crackles and a bit of a wheeze.
As well as being generally unwell, for some reason babies can find themselves with diarrhoea. Don't ask me how that one's connected though.
I guess the take-home message is that babies can present in all sorts of ways, and the story is usually really vague because they can't say what's wrong, so you need to get your Sherlock on.
The good news is the management is all the same, a bit of that nice banana medicine.
We don't throw antibiotics out willy-nilly anymore, Adam.
Good point. Well, thanks for watching our video, hope it was useful. Bye!
Bye!